Good morning, sir.
Good morning.
How are you doing today?
Fine.
Can I know your name, sir?
Yeah, myself Dr. Avinash Chandra Singh from Shore Neurology and Agrim Hospital, Varanasi.
Okay, all the way from Varanasi to attend this conference.
Yes, yes.
How do you like it, sir?
Yeah, fine.
How do you like the idea of awareing people on epilepsy? How do you think the era of understanding amongst people is changing?
Yeah, I think it's very important to help people be aware of epilepsy because there are a lot of myths are associated with epilepsy because many people don't feel it as a normal disease and feel it as a curse or something else rather than a disorder, but it's actually a brain disorder and it can be treated like any other illness.
Okay, and also I would want to ask you, there are a lot of people who are very conscious about their presence in the public area. Like for example, I am somebody who's getting, the problem. So if at all I'm in a public area, for example, I'm in my office and my colleagues go see me go through Caesar. So it's very embarrassing at times for the people who are facing it. So what message would you like to tell them?
Yeah, I would like to say if you are suffering from epilepsy, mostly it is very well controlled on medication. So many times what happens if it is controlled, the person tends to forget the medicine or they don't take medicines regularly, and that is the specific trigger for having a breakthrough seizure. So that is a problem. You should take your medications regularly, and secondly, at your workplace, you should inform your colleagues that you are suffering from this problem. Many times it do happens even if you are taking medicine, you can have a epileptic attack. So they should know it beforehand so that they should know what has to be done if you are getting a fits right in front of them. That is, they have to know the specific precautions that if you are having throwing a seizure, you should be kept in a lateral position and should be kept away from anything which can injure you. And usually the epilepsy subsides by itself. Otherwise, if it continues for more than 5 minutes, you should go to immediately to a nearest doctor or hospital.
Also, sir, I would want to ask you, how important is it for people to be aware of it?
I think you should be aware because as you told, if you are getting a fit at workplace and if they are not knowing about your illness, they might get panic and you can also suffer an injury during an attack. And you should be very aware about the patient per se should be very aware and their employers should be aware because many working place, if their fits are not controlled, you should avoid it, like working near the moving machinery or near fire. That should be avoided if you are not very well controlled on medication.
Also, how many times does a person need to go through to understand that he or she is finally under the problem now?
It's,
आई मीन टू से कितनी बार एक इंसान को अगर फिट्स आते हैं तो कितनी बार में उसको पता लगता है कि उसको फाइनली ये बीमारी हो गई है?
No, I think the epilepsy is defined as like you are having two or more unprovoked seizures. That is being defined as epilepsy. Per se, seizure can be triggered due to, say, if you are extremely overworked, yeah, exertion is there. Even a normal person can throw a seizure. Or you are having a simple, say, electrolyte or blood sugar abnormalities. That can lead to a seizure attack. But that per se may not require a long-term epilepsy treatment. If the cause is corrected, then you may not require an anti-epileptic medication.
So, are you saying that not all fits are epilepsy?
Yeah, definitely, not all fits are epilepsy.
Okay, thank you so much for your information, sir. I think this was very useful and required for the audience who's watching us right now. Thank you so much.
Thank you. Thank you.
Thank you.